Start, and recording is going. All right, thank you so much, everyone, for the privilege of your time. My name's Scott Yeager. I'm the outreach manager here at Pennie, and we've got a lot of exciting information to share with you this afternoon during this webinar. Please know that this webinar is being recorded for resource purposes to be shared with CPAs and tax preparers across the Commonwealth of Pennsylvania. All attendee lines are muted, and we do have an active Q&A function within MS Teams Live. So if you have questions, please feel free to add your questions to that Q&A. We will answer some questions during the session today. And for those that we can't get to right away, if you pose your question and also submit your email address, we'll be happy to forward that information about your specific question along to you. That being said, we're going to jump right in to our agenda for today. We're going to tell you a little bit about who Pennie is because, well, as a state agency, we've only been around for a couple years. We're going to talk specifically, though, today about a very new program that we're excited about called the Path to Pennie. And we're going to discuss how the program works, how as tax preparers and individuals that work with businesses and with individuals and families, how you can help us not only connect your clients and customers with affordable health insurance, but with financial assistance that can go a long way in helping the uninsured in Pennsylvania get protected. We're also going to discuss timelines and support here at Pennie. So without further ado, heading into an introduction of who Pennie is and how we help Pennsylvanians. Pennie officially launched as a state-based marketplace here in the Commonwealth of Pennsylvania back on November 1st of 2020. Our mission is very simple. We want to make sure that individuals who don't have access to health insurance through their employer, through medical assistance, they might not yet be in a position where they're old enough to age into Medicare and Medicare options. We're here to help. And we do that in a number of ways. Number one, we are the official health insurance marketplace for the Commonwealth of Pennsylvania. But more importantly, we provide high quality health insurance options with many of the major health insurance carriers that are well known here in the Commonwealth of Pennsylvania. And more importantly, we are the only source for financial assistance in the Commonwealth of Pennsylvania to help reduce the cost of coverage and care. We predominantly exist to help individuals and families who don't have access to employer-sponsored coverage. They may not have access to coverage through medical assistance or through Medicare. And an important factor to keep in mind is that as we meet here today, 1 in 20 of our friends and neighbors within the Commonwealth of Pennsylvania wake up every day, they go out into the world without the protection afforded through quality health insurance. Coming out of our most recent open enrollment, which was just a couple weeks ago, on January 15th, Pennie was able to protect 371,000 Pennsylvanians. And again, the most significant factor is 9 out of 10 Pennie customers, 90%, receive financial assistance to help them and their families address the most important question, and that is, can I afford it? Very quickly, Pennie has financial assistance that truly does make a significant impact on helping individuals and families and small business owners address that question of, can I afford it? 1 out of 4 Pennie customers currently pays less than $1 a day, less than a cup of coffee for their health insurance. 14% of our customers pay less than $1 a month for their health insurance. And 40% of Pennie's customers pay less than $75 a month, less than most cable bills or mobile phone bills for quality health and dental insurance through Pennie. Our health insurance that we have on Pennsylvania's marketplace meets the 10 essential health benefits of quality health insurance. We cover things that matter. We cover prescription medications, maternity and newborn care, mental health and substance abuse disorder coverage, as well as preventative services, emergency services, outpatient, and hospitalization services. But here's the important factor. The important factor is a lot of our friends and neighbors here in Pennsylvania are experiencing transitions. And that can happen not only during tax season, but any time of year. And again, this is where the Path to Pennie can really help. A key component of Pennsylvania's marketplace of Pennie is customers cannot be denied coverage because of pre-existing conditions. And for individuals who might be between jobs or transitioning from employment to small business ownership or transitioning in some form, pre-existing conditions can be a significant factor. Also, individuals who are under 26 can remain on their parents' coverage. However, at the age of 26, it's important to note that Pennie will be here any time of year to help those individuals who are aging off of the coverage that was provided to them by their parents. At this point, we'd like to dive right in to our discussion of the Path to Pennie. And at this point, I'd like to bring on my colleagues, David Thompson, Pennie's policy director, Emily Zido, one of our policy analysts, to help educate you on how this new program can help not only protect your customers, but improve their quality of life. Emily, David, please take it away. Hey, Emily, how are you?
Thanks, Scott. Appreciate it. Thank you so much for that nice introduction. And welcome, everyone. Thank you so much for joining us today. My name is Emily Zido. I'm a policy analyst with Pennie, but I'm also importantly the daughter of a CPA. So I very much so appreciate your profession and the services that you all provide as tax professionals as well. And you're an important connection for us to make. Scott, you can go to the next slide. And I'll show everyone just a little overview of what Path to Pennie is about. So again, we're very excited to be speaking with you as tax professionals because you are going to be a really great bridge to the community and the uninsured this tax season, hopefully for us. And we'll talk about the Path to Pennie. So this is a program that was created to connect uninsured people living within Pennsylvania with health coverage during tax season. So again, Pennie, we are a government agency. We are the Patient Protection and Affordable Care Act at work in the state of Pennsylvania, and all those nice health insurance benefits that Scott introduced on the previous slides, those things were mandated by the Affordable Care Act. So we're really happy to be doing the work of connecting people with quality health insurance here in PA. And so the Department of Revenue, another agency in Pennie, teamed up to allow uninsured tax filers to indicate that they wanted to get some more information from Pennie during tax season when they file their state return. And this is done through a new form, the Rev 1882, which is titled Health Insurance coverage information request. And this form is not, filling out this form is not the same thing as actually applying for health coverage through Pennie. What this Path to Pennie does is allow for the Department of Revenue to send Pennie information from people who want to hear from Pennie because they don't have health insurance. So when you fill out Rev 1882, or when you assist a tax filer to fill that out and state that they don't have health insurance, Pennie will get information about that person to reach out to them and hopefully connect them with more information about actually taking the step to enroll. And that'll come in a postal mail notice. So the next slide will go over a little bit more detail of what Path to Pennie looks like. So this is just an image of what the process basically is. So we start with filing your taxes. So you have your federal and your state return. And when you get to the state return portion, there will be Rev 1882, that health insurance coverage form. We'll go over that form in detail a little bit later in the presentation, but you start with that and indicate, if you don't have health insurance, or if it's another member of your family who's a dependent or a spouse, anybody in your household, that's also somebody who you can click as, or you can check off as not having insurance, and we can send information to you about getting them insured. The next step after a person fills out that form is that the Department of Revenue will compile the information and securely transfer to Pennie some basic information about the people who want to hear from Pennie. That's done securely over the web. And then Pennie next takes that basic information, address and name, and sends a notice, or paper mailed notice, to those people who completed the form. So it should be a pretty simple and straightforward process. There can be a little bit of a time lag in there depending on when a person does their taxes. So a person filing within the normal tax season would hear from Pennie soon after that. Other people who are filing outside of tax season would hear after they've filed their taxes as well. And then we have just a little learn more button there if you guys want to take down information about pennie.com and the Path to Pennie following up in this webinar, you can look there. Next slide, please. So this is Rev 1882, that form that I had mentioned. This is included in tax filing software when a person in Pennsylvania filing taxes for Pennsylvania goes to hit submit. So this form should be supported in the majority of tax filing software this season. We know that the Department of Revenue directly supports this form through their portal. We did a tremendous amount of outreach this spring, or pardon me, in the past few months to connect with tax vendors operating in the state of Pennsylvania to make sure that they knew about this form and were choosing to support it within their software. So the majority of software tax vendors should have this form. It's also available through paper filing. This is a form that we're working to make sure all that all tax vendors support. Again, the majority of them should support this. Next slide, please. And this is a little bit closer up of what Rev 1882 actually asks. You can see that there's a spot for an email address and a phone number, and that's how Pennie we compile that information along with their personal address so we can send that paper mail notice about Pennie. So the first question just asks, do you not have health insurance? The second one is, does your spouse not have health insurance? A third one is, do your dependents not have health insurance? And then the fourth is a consent bubble. So we want people to be actively consenting to having the Department of Revenue share their information, or their basic information, with Pennie. So we put that importantly on the form so they can see that. Otherwise, if they don't check that, we won't do any communications with them. The next, number 5, is about consenting to allow Pennie to communicate you with phone or email. So if we have any follow-up, we do send a paper mail notice, but we create a very basic online account for that person to stay in touch with them about moving forward and learning more about health insurance. And then number 6 is important. So this is estimating your adjusted gross income. So you take that from your federal tax return, and this is where you can help somebody who's tax filing. And what Pennie does is use that very basic adjusted gross income number to estimate if the person, based on their household size, how much federal financial assistance they might be eligible for. So Pennie, again, is the way to connect people with federal financial assistance to lower the cost of their health insurance premium every month. Again, we use that as an estimate. So when we send out that paper mail notice, it'll be included in there. If a person doesn't fill out number 6, then we're not able to provide an estimate. So it's just important that you help a person make sure that their adjusted gross income is written in that space there. And then number 7 is providing the number of household members. Again, we use that information to help estimate federal financial assistance. And then there's a little bit more space about providing dates of birth and ages for people living within the house. Okay, next slide. And I think now I will pass it off to my colleague, David, who is Pennie's policy director. Thank you so much for your time and for being here today.
Thanks, Emily. And I'll go through a little bit more detail about some of the notices and communications that tax filers will receive once they do submit Rev 1882. So the key is, those tax filers who indicate on this form, either via paper or when they're electronically filing, they indicate that they, their spouse, or dependents are uninsured on the form, they will receive, at minimum, an official notice from Pennie with critical information detailing, 1, how to claim their newly created Pennie account. So Pennie will take the information provided on Rev 1882, and it's very important that everyone fill out the entirety of the form when they do submit it, so that Pennie can create an account with an access code as included in this notice for a customer to directly click on and claim their new Pennie account. In this notice will also include an estimate of the financial assistance that the tax filer and their household may be eligible to receive. And as Emily pointed out, this is based on the federal income included in Form in Rev 1882, as well as the number of people in the household. That's why it's very important that a tax filer include the dates of birth for all individuals seeking coverage, so that we can get as accurate of an estimate as possible for the financial assistance that people might be eligible for. And then thirdly, there is another more information included about how the tax filer can enroll in Pennie coverage using the automatically created tax filer special enrollment period. So Pennie has an annual open enrollment period that Scott mentioned that just ended. But if someone wants to enroll in coverage during the year, they need what's known as a qualifying life event. And submitting Rev 1882 indicating that they are uninsured is that qualifying life event for these people, and that is automatically created in the Pennie system along with their account information. So this is kind of shows some examples of the notices that customers will receive, as well as outreach materials in the event that someone has submitted Rev 1882, but they have yet to claim their new Pennie account for whatever reason. A couple of things that we learned from last year. Last year was our first year doing it. One of which was we worked with the Department of Revenue to make sure that tax filers understood that they provided specific consent to get information from Pennie. And provided specific consent for the Department of Revenue to send their information to us. We don't want anyone to be surprised when they get an outreach from us. We want people to understand and expect that they will get an outreach from us. And so we wanted to solve for some of the confusion that existed last year. Next slide, Scott. Okay. So we've included a couple of FAQs here that I'll go through in some detail, just to kind of put a finer point on what we've been talking about throughout this presentation. So first of all, who can use the Path to Pennie tax filer special enrollment period? Well, any Pennsylvania resident who files Rev 1882 with their Pennsylvania tax return, indicating that at least one member of their household is uninsured and consents to being contacted by Pennie, can use it. So when they claim their account, then that's when they will submit. That's when they will provide information that makes up their application, and that's when they'll get their official eligibility determination and can shop for a plan. Anyone who fills out this form is eligible for the SEP. In terms of eligibility for coverage, that's based on information that they'll provide in their Pennie application. How long is the tax filer SEP? So like other qualifying life events that customers can qualify for throughout the year, this special enrollment period provides customers with a 60-day time period to apply, shop, and enroll in coverage through Pennie. And the special enrollment period starts based on when the customer receives their notice from Pennie. So not only will they receive their Pennie notice in the mail, they'll also get an email alert letting them know that it's available electronically in their secure Pennie inbox. The email itself won't contain the notice information, but it will alert them that it is available for them to view in their new Pennie account. And so the 60-day clock starts from when that notice is generated. And then once somebody does apply, shop, and enroll in coverage, coverage will generally be effective the first of the month following the time that they actually enroll in a plan. And so the next slide will kind of we'll show kind of a timeline of what the Pennie plan year looks like in general, but it is important to note that we expect to get the majority of these forms during tax season, so January 23rd through April 18th. However, we'll receive files from the Department of Revenue throughout the year. So if somebody files and gets an extension and submits their form that way, we'll get it. If they amend their tax return and submit it, we'll get it that way too. So just because tax season's the official tax season's over doesn't mean that someone can't go back in and submit this form with their taxes, and we will receive it. And one of another kind of lessons learned from last year is we did a great job working with the Department of Revenue to set up the program. Unfortunately, we forgot to let the tax vendors know about it from our side. This is an optional form. So many, tax vendors, they had the capacity to support it, but they ultimately didn't. This year, we've addressed that, and the overwhelming majority of tax vendors in Pennsylvania will support the form this year. In the last year, we created a kind of a manual way that tax filers could avail themselves of the special enrollment period if they didn't have Form Rev 1882 available to them when they submitted their tax return. This year, it'll still exist, but we expect that to be used way less frequently, as nearly all Pennsylvanians should be able to see this form. The next slide. So you're probably wondering, how can you help? Why are you here today? And the reality is, we understand that as tax professionals and preparers, you are the ones that will determine the success of this program. And so we wanted to make sure that we get this information in front of you. So when you're with so we talked about who is eligible for the Path to Pennie. So households where the primary tax filer, their spouse, and/or dependents are uninsured. So the first thing is, if ask your client, are you uninsured, or is someone in your family uninsured? Those are the ones who should be filing a Form Rev 1882. If someone has health insurance and their whole family has health insurance, they don't need to support the form. We can't really help them if they currently have health insurance. But if they don't have health insurance, no matter who it is, we want them to submit the form, and that's what this program is all about. Why? Because this is an opportunity for Pennsylvanians to get connected to quality, affordable coverage through the state income tax return, and this is really about kind of meeting people where they are. And then again, what can you do? It's really actively asking your clients if they or their household members have health insurance, and if not, encourage them to fill out Rev 1882 in its entirety. It's really important that we get all that information so we can create an account, have an accurate estimate of their potential eligibility for financial assistance, and make sure that they get that notice. So next slide. And this is just kind of a heat map of the uninsured, just kind of for your background, and this kind of informs a lot of our outreach and marketing strategies. But you'll see, the deeper the blue, the darker the color blue here, the more uninsured people there are. So if you no matter what county you live in, there's someone who's uninsured and someone that you might be able to help. So as I mentioned, there are different parts of the plan year when people can apply, shop, and enroll in coverage. The first one is the open enrollment period, which just ended. So for 2023, the open enrollment period went from November 1st, 2022 to January 15th, 2023. And in open enrollment, people could sign up whether they have a qualifying life event or not for health insurance through Pennie for the next plan year. This program is for those who missed the open enrollment period and still don't have health insurance. So we've kind of marked on this timeline the dates of the tax season. But again, any people can qualify for the tax filer special enrollment period anytime throughout the year that they submit Rev 1882. And now I'll kick it back over to Scott.
All right, thank you so much, David and Emily. And again, everyone, we recognize the fact that not everyone has or is born with an inherent knowledge of health insurance. And we'd like you to know that there are resources here at Pennie, not only to support you, but to support your customers and the clients that you serve. The most important referral number that we can provide you is the one that you see at the bottom of the slide here. It's 844-844-8040. Pennie has a network of support available through our customer service center that we have here at Pennie. We have unbiased professionals who are always ready to help answer questions that your clients may have, to help them figure out what they qualify for by way of financial assistance, and ultimately to help them explore the plan options, both health and dental, that may be right for them and for their families to help them protect their quality of life. Also, in local communities throughout Pennsylvania, we have Pennie Assisters, who, much like our customer service representatives, are unbiased professionals who typically work for hospitals, health centers, community organizations, faith-based organizations that you and your customers may be very well acquainted with. Our assisters, again, can provide the unbiased help and resources and customer education that people so desperately look for in helping them get to a better place. But also, like yourselves, we have thousands of Pennie certified brokers who are licensed professionals here in the Commonwealth of Pennsylvania who have a unique distinction in being able to work with and support those clients who may have very strong concerns about pre-existing conditions or options that are available to them and their families. We have Pennie certified brokers throughout the Commonwealth who are ready and very eager to help your customers who may be uninsured get protected. Again, one referral to 844-844-8040 can be a tremendous help to anyone who is uninsured. but also can be a pathway to connecting them with local resources in their community who can help them get protected. One last thing that I'd like to mention is Pennie has a community work group. We conduct our community work group sessions every month, and through those community work group sessions, we can help you, we can help your colleagues, we can help individuals get answers to questions that they may have about health insurance, dental insurance, and the financial assistance that can help them help their customers get beyond that barrier that so many face in terms of addressing the question, can I afford it? With that being said, I know that we're 1 minute over, but we're going to take a couple seconds here to review the Q&A to see if anyone had any questions. Again, we encourage all of you to share this recording as well as the information about Path to Pennie. And I see that Emily has been very active in answering questions in the chat. And what I'd like to do is I'd like to start just by addressing some of the questions that we have here. One of the questions that came through was, I have TRICARE until February 1st. I've contacted them a few times to get a letter stating my end date. They're unable to provide a letter until February 1st. I want to enroll in Pennie to be effective February 1st. Is there any way to bypass needing this letter to get enrolled? With that, I would say, from my perspective, and David, Emily, you can help with regard to answering this. There we go. One of the questions that we had is related to TRICARE and getting enrolled. Anytime you find yourself in a position where you have questions, again, 844-844-8040 is the best number for inquiries. In terms of getting connected with health coverage, regardless of what your qualifying life event would be, making a referral to that number would be fantastic. A question that we have here is your system going to be provided the SLCPS premium amount for PA residents when this information is not provided on the Form 1095A, as information was not available last year on the Pennie website? That is something that we will look into. David, Emily, were there any questions in the Q&A that you want to call out?
Sure. Thanks, Scott. On the TRICARE question, if you are losing what's known as minimum essential coverage, also TRICARE qualifies under that umbrella. You don't need a letter. If you go through the application, select the loss of minimum essential coverage special enrollment period in your application, and put the date in which you will lose coverage, yes, the special enrollment period will open for you. So you don't need a letter to verify that. You could just come in, select that SEP or special enrollment period, and enroll. In regard to the second lowest cost silver plan question, I don't know if we publish that information publicly. But we can get back to you. And then there was a question about the underinsured qualifying for the program. I would say that if someone is on, has health insurance that doesn't meet the minimum essential coverage, so maybe it's a short-term limited duration plan, maybe it's an association health plan, or coverage through a health insurance ministry, that does not prevent them from enrolling in coverage through Pennie if they have another qualifying life event. So that if they have another qualifying life event, or they want to submit Rev 1882 with their taxes, they will be able to enroll there. And I guess, what I would add to the presentation is if someone is uninsured or has one of these sources of health insurance that is not comprehensive, that doesn't meet, the Affordable Care Act standards, they should fill out this form as well.
Fantastic. Emily, David, thank you so very much for your time this afternoon. And thank you, everyone who's joined us today for the privilege of your time. Again, if you know of someone who is uninsured or someone who may benefit from the Path to Pennie, 844-844-8040 is the referral number. We will make a recording of this available to participants today, but also as a resource for sharing with your colleagues and those individuals in your community who may be interested in learning more about Pennie. So with that being said, thank you so very much, and we hope you have a peaceful week. Stay safe, and we hope to hear from you soon. Thank you.